Welcome back to No, I'm Just a Worm with your hosts, Ann, Jeanette.
And Jess?
And this week we are talking about, I guess, an illness, not
Just
yet.
call it what it is.
Yeah, okay. It's called breast implant illness. It is not,
It's not an official diagnosis of anything.
yeah, it's not.
Not of anything.
The medical community hasn't accepted it as an actual
It's,
thing yet.
Yeah, so you're not going to find it in any official medical journal as far as this is definitely an illness. There is no insurance. This is how you know when it's real. If there's an insurance diagnostic code for it,
Yeah.
it has officially become accepted in the medical community.
Exactly.
And as far as I know, as of right now, you cannot go to your doctor and, on that official diagnostics of why you were seen that day. It's not going to be what BII.
Yes.
It's not going to be on there.
Yeah.
But it is something apparently. I didn't know about it up until talking to you about it. So,
but we're gonna get into the meat and potatoes of that a little bit later. But first, our segment that we're just introducing now is what the fuck is wrong with us?
Yeah.
We've had a rough day of
so rough.
We've been recording and working on episodes since
11.
Yeah. Well, it was supposed to be 10:30.
And then, all right, so it was supposed to be I was supposed to get here between 10 and 10:30.
Okay. We have to preface that, though, first.
Do we?
Yes.
Do we?
Yes, we do. Because okay. We had agreed that we were meeting between 10 and 10:30.
Yes.
And the day before, there was a whole bunch of snafus that had happened. But whatever. We'll get into that part later. What I had told her, I showed her the new setup that we have. I showed her a picture. I was like, hey, this is what it looks like. Minus the mics and the cables. So she said, do you need me to bring anything tomorrow? I was like, it should just be the mics and the cables. I think we managed to kind of jerry rig stuff enough so that we'll make it work.
Yeah.
So all I got to do is bring the mics and the cables. And we had agreed before last night to meet between 10 and 10:30. So she was on time.
I was 10:15, right in the middle.
Yeah.
I was doing good.
Yeah. And I think you left at 10.
Yeah.
Got here at 10:15. So she walks in, she immediately has to go pee, and I'm out here and I'm like, I don't remember her bringing any. Where are the mics? Where are the cables? And so I call through the bathroom door and I'm like, hey Jess, do you have the mics? And she's like, oh, I thought you grabbed them. And I was like, no. She's like, fuck.
So the reason why I thought that she had grabbed them, she was over Friday, she had grabbed the mic stand thingy, the holders and the interface, and my brain just went, yep, she got everything, we're good to go. Despite the fact that we both had discussed this several times, even I said, I was like, all right, I'll make sure it's okay with Will, he's not using them, I'll grab the essentials, the very thing that allows us to record an episode. You made the mistake of allowing that responsibility to fall on me.
Yeah.
So I was very lucky that there weren't any cops out in my way from here to the house and back.
Yeah. At first, she tried to get Will to bring them to her so she wouldn't have to drive back.
I for whatever reason, I don't know why, but I actually had high hopes that he was going to do that.
I don't know why either.
I don't. Yeah,
that's never worked in your favor.
No. Nope. So
there was that. And we get everything set up, and then we have to try. This is the first time we've done a recording with this camera in this room with this setup. So we had to make sure that we had the lighting the right way and that it wasn't too dark, too bright, too whatever. To get that sorted out, it took 15 to 20 minutes.
And that being said, you should turn on that lamp, because I'm going to tell you right now, as the sun's going down, and as we continue to go in this episode, it's going to get dark. I love you.
I hate everything about everything.
Just turn on the lamp. Anyways, so it's been a rough day, and a lot of it has been issues in general. Now, what are you doing? What are you? You literally did nothing to it. You touched it. It didn't do anything.
Well, because whatever.
All right. Anyway, so
there's stuff wrong with us.
So we decided to come up with a segment, what is wrong with us? And I'm sure everyone can relate where they're having a rough day or they're just doing something silly and stupid. Like, what is wrong with me?
So you had a bad day. That's every day. That's every day.
Is it?
There's something wrong with me every day.
Oh, well, yeah.
Not like bad day.
Yeah.
I'm just like, I guess, yeah, I understand where.
So, but I mean, I think it's anything though, like today where it's just like it's constant mistakes and like mess ups and you're just like, oh my God.
She still can't. Oh, so we decided to introduce these segments. And every time before right now, she would go to like say that, she would say statement instead.
Apparently, I just really wanted to make a statement about something.
Yeah, a statement about our pet peeves, a statement about what's wrong with us. And technically, you're not wrong. It is a segment of statements.
Shut up. No, but I think though, also like when I think of like what is wrong with me, it's just like weird stuff that you do.
That you do or I do?
In general.
We do.
Yeah. So if you sit back and you notice that you're starting like a quirk about yourself, or just like, what
little
is
idiosyncrasies
wrong with me? Yeah. So one of them, and we've discussed this before about we did about a month or two ago, we did a topic Tuesday on something that you're kind of low-key obsessed about. And mine is houses, particularly old houses. But I'm a creeper, and I take it to the next level where, like, in our neighborhood, we live in a very old area. So if I'm in like a historic section of town and I see a house for sale, I will go home and look it up. Yeah. I don't know what's wrong with me. I know it's weird and it's creepy, but like I want to see what it looks like on the inside.
Okay. All right. I mean, because I have a lot of quirks, I'm not going to say that that's a bad one. You just get off. You just get off on seeing
people's houses that they're currently living in that's for sale when I'm not looking for a home to buy.
It's not like you're like tapping into their security feed and watching them sleep or anything. I feel like that would be worse. Right?
Well, significantly worse, and I don't think I'd admit to that if that's something I did.
Yeah, I guess not to the internet at large.
No.
But yeah, I have many things wrong with me.
Share with the class.
I don't know if I want to. Okay. Well, this was something recent that happened. I don't like so when I get mail, whether it's junk mail, whether it's important mail, whether it's a package from like Amazon or whatever, I don't just throw out the mail. I can't. I need to like shred it or something.
Even if it's just like an advertisement, it's just nothing.
If it has my name and address on it, I don't want to just throw it away. It needs to be shred or something or burned. I've seen a lot of shows like Criminal Minds and stuff like that where people will dumpster dive and try to find like information, like people that would throw out their credit card statements.
Wow.
Or they would throw out their phone bill or whatever when they were done paying it online, like they would just throw it away. And because that is technically public property when it's out on the sidewalk or whatever.
True. Yeah.
People can just go in and look at your information. Or again, because I've watched a lot of Criminal Minds and true crime shit and stuff like that, and there are stalkers out there. Not that I'm not saying that I have one or anything, but like
I think you need to stop watching that show so much.
No, I think they do me good. It's a healthy dose of paranoia, I like to think.
Uh-huh.
So that, I guess, is what you could say is wrong with me. So I'd had, because I didn't have a shredder here, I had like a whole fuck ton of labels with my name on it, like name and address, like pieces of mail, all this kind of shit that I had collected. And Steve was like, "Oh, okay, I'm gonna put it in like one of those like HIPAA bins."
Yeah.
And then they'll take it and they destroy it. So I was like, okay, cool. If your supervisor to a school, we'll do that. So it takes me an hour to clean out.
Oh my God.
Because I had to take boxes break them down, take the labels off of them, compile all of the mail into a big black garbage bag. And I had trusted Steve that he was going to go and take them, because this is what he said he was going to do. He was going to take it to his office, have it shredded. So yesterday, I think it was yesterday, whatever day it was recently, he was like, "Oh, I took that bag and I got rid of it."
Yeah.
And I was like, "Oh, so like you took it to the office, blah blah blah." And he's like, "No, I got rid of it." I'm like, I was like, "What do you mean?" He's like, "I just got rid of it." I'm like, No. What did you do with it? Tell me." He's like, "I just threw it in a dumpster." I'm like, "What?" Very long story, still long. But summarizing the end, he had to go dumpster dive for that and take it to his office.
So what I think you guys should do is just get one of those like hobo burn barrels.
That's
Just
what I was
sit
going
it
to do,
outside,
and
yeah, just burn it.
he didn't want me to burn it. So I got a shredder.
All right, that works too. But
And I've been keeping up with shredding everything now. Like after that,
see, I'm surprised that you're not taking it to the next level and then taking like what's been shredded and then burning that.
I was going to, and he said that was insane.
It is.
So I just shred it, and it's one of the cross-cut ones, so
Right.
little bitty
Yeah,
pieces.
like confetti.
Yeah. So I was
So
like,
you're good.
all right, that's fine. Whatever. So I'll get rid of that, and that'll be fine. So that's one of the things that is wrong with me. One of the many, many, many things. So you think that I'm crazy?
I think you're a little bit more. I think you're a little overprotective, but I don't think it's like too neurotic up until you were going to burn the shredded material.
I think it's good Tinder.
Okay, so that's not what we're talking. So the situation isn't, hey, it's nice out, like let's do a fire pit and just have some beers and like, hey, we need something to, to catch the stuff on fire. That's not what you're saying. You're saying I would shred it and then take it outside right now and set it on fire just to be sure.
I mean, I
And
wouldn't
you
do
know
it
it.
immediately. I would, if that's full and we're having a fire pit, I'll use that.
That's not what you were saying. You know it.
Yeah, it is. I think that you're putting words into my mouth.
Am I?
Yeah.
Yeah.
And you're trying to take my crazy to a whole new level. I think that's rude and uncalled for.
So one of the crazy things that I do that you've recently witnessed, and that I'm proud of myself. Although my skin is crawling just thinking about it, and I'm really irritated about it, and I'm surprised that I haven't cleaned it up yet. I am anal about how clean my bathroom is especially when it comes to the floor.
Oh, yeah.
So we recently redid our bathroom, and I made the mistake of getting a white marble floor. I don't know what I was thinking. But now you can see
She likes seeing dirt.
See every speck of everything. But one of the things that drives me nuts is when Will shaves. Because I don't know what he does when he manscapes, and I've complained about this for 10 years, but it's just like a bomb of hair went off. It's everywhere.
Yeah, I think he uses it as confetti to celebrate the fact that he is clean shaven now.
Maybe. I don't know. But I'll go to the point though where like typically I'll clean it up right away. And when I say clean it up, I don't mean just like a little dustpan and sweep. No. I shake out the bath mat, I put that away, I sweep, and then I use the dry Swiffer, and then I'll continue to sweep again until I get every speck up, and then I'll mop, and then I'll make sure it's super dry. And then God forbid, if anyone comes in after, which their shoes on, or if he like forgot a piece and needs to shave again, like I lose my mind. To the point where I can't just let it go. I gotta like clean it again. I don't know why. Because it's inevitably just going to get dirty. It's naturally going to get dirty. It's a floor.
Yeah.
And while I'm doing this, I'm like, what is wrong with me? This is not normal.
Yeah. Steve and I went over the one day, and she was like, "So you guys are probably going to kill me, but if you're going to go into the bathroom, if you could take your shoes off." Because I just cleaned in there. And we're like, you have a white floor, and it's tile, so easily cleanable, but it's white. So You're fighting a losing battle.
I think like all I asked for at this point, where like I'm just basically trying to negotiate with my crazy, is I want it clean just for 24 hours after cleaning it.
It's asking a lot, but okay.
Like, we don't have kids. The dog doesn't go in there. I feel like that's pretty reasonable request of like, just walk in there either barefoot or with your socks on, and don't shave.
Bare feet. That is something I think it's probably just been not physically beaten to me, but just kind of like any time. My dad would not, if he saw you barefoot in the house, he would mentally beat you. And then like would just be like, where are your poochies? I don't know.
Where you what?
Poochies. That's what he calls slippers. I don't know
Oh,
if that's an actual Polish word or if that was just what his parents called slippers. I don't know. I don't know if that's like a Polish colloquialism for slippers. I don't know what it is, but he calls them poochies.
okay.
So he's like, "Where are your poochies?" I'm like, I never really had them. Like, but I had socks. So
Were socks not good enough?
No.
For him? No.
no, but he's also diabetic, so he has to have good, like, he has to keep his feet
Yeah.
warm. And me having Raynaud's, like, that's understandable. Like, I need to now, like, I think because of him and also because I developed Raynaud's, like, I need to have hands and feet, like, warm.
Yeah.
It is very rare that I'll have them, like, not sucked or have something on them because that is madness, I tell you. Madness.
Yeah. I think I've gotten better with at least putting socks on in the house. I do have Raynaud's, and the only reason why I honestly probably wear them consistently now is Will screaming at me. Your
Because you're
toes are
cold feet?
yeah, and they're turning blue and they're swollen. Like, put something on them. What is wrong with you? I'm like, oh no, I don't like stuff on my feet.
Oh, that's right. You're an anti-foot person.
I am. See the irony again. What's wrong with me? Is don't touch my goddamn feet. Don't put your feet on me. Get your feet away from me. But at the same time, I don't want stuff on my feet. I love to go barefoot. I don't know.
I don't like it. But the also a double irony on top of that. When I had my foot on Koo earlier and you were touching my foot with your foot,
Because they're socked.
and because your feet are socked.
Yes.
So socked feet can touch socked feet.
Yeah. So feet.
But you can
like,
touch
alright, so,
my
like,
you can
so-
touch my feet with your feet, but
yeah,
I can't
so,
touch.
Like, let's do it now. So like, boop.
Ooh,
So like foot to foot.
that's fine.
Especially fine. Don't put your feet anywhere above my foot.
All right,
So
that's
once
fair.
it gets past ankle,
Ugh.
and then like just hand wise, like don't put your hands on my feet.
My feet.
Yeah.
So you are not a pedicure person.
I've gotten them before for the photo shoot
Yes.
for like just high end events. I will go get one done. I've had maybe 5 my entire life.
And you've survived.
Yes,
It's
I
been
can tolerate
rough.
it.
Yeah.
I can tolerate it, but I prefer to like just paint my own toenails and just leave it at that.
That's fair.
So, but yeah, the irony though, I like the socks that I have on right now, and my feet are freezing. Like I guarantee, if I take my sock off right now, they're cold.
Yeah.
I would rather have them off. Don't like the way I don't like shit on. I don't know. I'm like you know, like when a toddler goes to the phase where they don't want to wear clothes
And that's just you constantly with your
with my feet. Yeah, I don't know why.
There's something wrong with you.
I mean, think about it though. During the summer, how often do you see me with like tennis shoes on? Like I'm usually just sandals.
This is true. It's rare that I wear something not on my feet at all times.
I don't know. But yeah, don't touch my feet. Don't put your feet on me. But I don't want anything on my feet.
It's a lot to unpack.
It is. So, also something that's a lot to unpack is this BII illness.
Nice segue.
Yeah.
But yeah, so for those of you who don't know, I got a breast augmentation at the beginning of November of last year. So, I had done, it was something that I had wanted for years, years, like ever since I could really remember. I wanted bigger boobs and like see if there was something that you could do naturally. And for some people, like if you're on birth control, depending on your body chemistry, it could make your boobs get bigger. And for a lot of women, that is true. For me, 9. It does not happen.
No.
It didn't happen.
No, not even a little bit?
No.
Huh.
I don't think so. They were pretty much always the same side. Like once I developed breast tissue, it was pretty much that all the time. And I had tried several different breast birth control methods.
Yeah.
I tried the pill, IUD, all these kinds of things. Several different variations of the pill,
Right.
but nothing. Anyway, so it was something I had researched on and off for the last couple of years, and then I think definitely since getting together with Steve, it was something that I had looked more and more into. I had started doing more research, kept on going like, this is something that I have wanted. So I started to like really try to like put my all into like figuring out cost effectiveness, whether or not I thought that it was going to be like a good fit for me, if it was something that I felt like I could live with, and all this kind of stuff. So I also started asking the people around me that I knew personally that had breast implants, and I was asking them all these kind of questions about like what kind of implants they had gotten, how the surgery was, how recovery was, and just trying to get research that way, because I feel like having firsthand experience is better than trying to like do a Google search and you can get like third hand experience that way, and then you also can't ask those people.
You can
Like,
ask so many follow-up questions.
Yeah, where like if I have, let's just say you had breast implants, and I could ask you X, Y, and Z question, and then you can answer me, and then I could like, oh, okay, well, how about this? How about this?
Right.
So, I was actually able to do that with a couple people, and got I got to pick their brain, blah blah blah, and then I started doing more research online, and then I came across this thing called Breast Implant Illness, or BII, and I was like, I have never heard of this before. In the research that I had done previously, that had never come up, it's like a fairly recent thing, and is mostly driven through through groups on the internet, about like just like thousands of people in these Facebook groups saying that they suffered from breast implant illness, which is pretty much a self-diagnosis.
Well, yeah, because I mean, I think if you read a lot of these articles, it's self-identified. So you're self-identified, which basically in turn means that like you yourself are identifying as having this illness. So there is no, like I said, official diagnosis from a doctor. There is, nothing where you're sitting down with the medical community. They're running multiple tests, and they came up with yes, like this test proves that you have this BII. It's kind of like, well, I maybe some people did get some tests run. The doctor was just like, it's everything that we're testing for. It's negative. Like you're fine.
Yeah.
They went online, saw this, like, oh, this is what I have then.
Yeah.
Which for me, like, I think when you were starting to tell me about it, and then we started to watch like some videos and read some stuff on it, like I think there's probably enough concern to warrant actual research and like for the medical community to actually start to look into this maybe a little bit more.
Yeah.
But I don't think, like, I think if I was in somebody's shoes, I, might maybe term it differently. Of like, this is something I'm concerned that I might have, but I want to do more research. I want to work with my medical doctor to see, like, to take it to the next step, not just, well, I got tested for everything else. And, this woman says, like, they share the same experiences. So clearly this is what I have.
Yeah.
There's no question about it.
When I had first looked into it, before today, again, just to like go over everything, the list of symptoms was long and varied and vague.
Yeah.
they the symptoms were things like fatigue, hair loss,
brain fog,
brain
memory
fog, memory
loss,
loss,
joint
um,
pain,
joint pain, uh, a-
neurological issues, but they didn't specify what.
yeah, on one of the lists that I read before today, it was stuff like anxiety,
Depression.
depression, hormone issues, and stuff like that. And it was like, well, this is, and there could be so many different other causes to this. It didn't like, and no one had actually specified if they had gotten tested for everything under the sun before they finally came to the conclusion, like, oh, okay, it's breast implant illness.
Right.
It was very vague. It was just it kind of seemed like it was more of a psychosomatic thing. Like there was one person that was like, oh, I have breast implant illness and these are the symptoms that I had, and there are people like, oh my god, I have these symptoms and I have breast implants. I think I have breast implant illness.
Right.
And like the example that you had given earlier, where like everyone in your office is sick with a cold or the flu, and then you start feeling like, oh my god, I think I've got a scratchy throat. And
Yeah,
like,
I'm starting to feel a little sweaty.
yeah,
I'm really
like
tired all of a sudden.
clammy.
Like,
I
oh,
think
I
I'm
better not
feeling
be getting
feverish.
sick.
And I think that that's also a very powerful thing
Yeah.
and can affect just about anyone. I know I've probably been guilty of it before, but it's just
Yeah.
like being influenced by those around you on something very serious. And like the one video that we were watching today, is that all these people were saying like, "Well, my doctor didn't warn me about this. My doctor didn't warn me about this." Blah 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 blah. And it's like, when you got your implants, this was like, what?
10, 15 years ago,
Yeah,
some of them.
and that wasn't even on anyone's radar. No one was talking about it then, and it's starting to gain more traction now. But of course, they couldn't have warned you about it then because there was no precedent. There was no history of it.
And even now, I guess technically because it isn't an official diagnosis and really doesn't seem, I feel like there really is no test for it aside for taking your breast implants out.
Yeah.
So me as a doctor, I might go over like, hey, listen, like depending on like what company they're going with for the implant,
Mm-hmm.
like, hey, listen, like the FDA has warned against like XYZ. I need to warn you about like certain type of lymphoma that you can get possibly. But am I sit there and what am I supposed to say? Hey, listen, there's an online community
Mm-hmm.
that's coming up with these symptoms, and this may or may not be true. I don't really know, and there's no way to test for it.
Yeah.
Like,
It's
really?
it's essentially like someone just like kind of similar to the anti-vaxxer thing, which the anti-vaxxer had there was, I guess it's kind of a discredit to this BII thing, like relating it to the anti-vaxxer movement, where they literally have no evidence whatsoever, and they're just
Well, not only do they have no evidence, but they have been proven wrong
yeah.
countless times.
But there was enough traction that the anti-vaxxers had made that made medical professionals go and try to disprove them over and over and over again.
Yes.
And I think now the women that have come forward saying that they have BII, like there's like you said, I think there's enough of them where it might warrant, studies to be done to see if that actually is a thing. The only thing that there has been linked to breast implants is a certain type of lymphoma, which seemed to be correlated to using textured silicone implants.
Right.
And that I was warned about when I went for my consultation. Because like when you go to see if you can get a breast augmentation, you get a consultation first with the doctor. And my doctor, I have absolutely no complaints. Everything seemed to be great. Like he informed me about all the types of things. I asked him about BII, and he had said that he's like, I haven't seen any kind of correlation to it. It's not anything that we've had any kind of studies on or anything like that. So I can't give you any kind of advice against it or give you any advice about it, really. The only thing I can say is about the lymphoma, and here's literature on it.
Right.
And I had gotten a whole, like a little novella about all the things that can go wrong with breast augmentation surgery.
Right.
And the lymphoma was in there. But the lymphoma had its own section, like a fairly large section. So like I feel like I was well informed from my doctor, and like it's not like he had never heard of BII before. I think he had heard people that had concerns about it but didn't like like you said, there's
What are they
people
gonna
talking
say?
about it, but there's not. Um,
There's not enough information for doctors to give you an informed answer.
yeah,
There isn't, and and not it's like you had an amazing experience with your doctor from start to finish. So not to discredit those out there who there's a good chance that you might have just had a really crappy doctor that may have not warned you about anything, may have not given you any information on the company that they were using that provided like the implants. Your doctor should be informing you of all of those things from start to finish and all of your options.
yeah,
So,
like
are there crappy doctors out there that aren't doing that? Absolutely.
yeah, and I feel like that's why you should try to like research the type of doctor that you want to go to as well. Just like researching any kind of major cosmetic surgery or surgery in general, whether it's like necessary or not. I would do research to see if it's something that you can live with, you want, and all these other reasons
Yeah.
for getting it. But like I tried to find the right doctor that seemed good for me. Um and he had a lot of really good reviews. I went in the consultation, like you were there.
Yeah.
He
He was
seemed
good.
to, yeah, he seemed really, really nice. And he allowed, well, one, I thought it was cool that he actually allowed me to have friends in the consultation with me.
Yeah.
And he was very professional. There was always a nurse in the office with us. Like it was never just me and him.
Right.
Um, but even if it were for whatever reason, like he had that professionalism where like there wouldn't have been anything hinky or anything.
Yeah.
And he was everyone in that staff was always very patient with any kind of questions. They always kept on saying, like, if you have any questions, don't hesitate to call us. And I did. Like, I had one concern at one point because I had experienced numbness, near the incision, uh, and I had like, I had been woken up with like the nerves being like, "Hey, I'm still alive," but it was like a
Coming back
burning, yeah, it
online.
was a
Yeah.
burning, stabbing, vice like pain. So I had called them and I was like, "Hey, is this normal?"
What is happening?
And they're like, um, they explained that it was normal. Not everyone experiences that kind of awakening of the nerves, but it
Right.
is normal. If it gets worse or anything, just come on in. Like, just call us, come in, and we'll figure out something.
Yeah.
And I was like, oh, okay. So from first consultation to doing several post-op appointments, they've been wonderful. And I know that's probably not the case for everyone. Obviously, when we were doing our research today, that wasn't the case. There were a lot of women that said that my doctor didn't say anything of this, blah, 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 blah. And
I think a lot of them too were just like, oh, my doctor was like, there's no risks at all.
that's
There's
what
no risk
that's,
for like rupturing. And I'm like, that should be a red flag for you. Because any
yeah,
surgery, like literally any, is going to have some sort of risk.
yeah,
I don't care what it is. It's going to have a risk.
yeah. That was part of the little novella that I got saying that, like, hey, these are all the risks of surgery in general. And these are the risks that could happen with this particular surgery. And I was like, oh, okay, cool, cool, cool. And it's a lot to take in. And that can scare anyone away, I
Yeah.
would think.
Oh, yeah.
But I liked the fact that they kept me well informed and they didn't seem to hide anything.
Right.
And I feel like if I had wanted to have a deeper conversation about BII with my doctor, he would have
Attempted to have
yeah.
that conversation with
Yeah,
no
he would have
information.
yeah, he would have been fine with it. And he didn't like he never once was just like, okay, I gotta go, blah blah blah. He took the time and talked to me
Yeah.
and tried to make me feel comfortable. And I appreciated that. But the thing that I take away from all of that, all of the people that have come forward with it, saying that they I think it kind of turns into like a hive mind, like herd mentality,
Yeah.
where they might be creating false memories about their consultation with their doctor, or because not a lot of people knew about breast implant illness even a few years ago. And to be like, well, they never told me about that. It's like, well, it wasn't really in the public's eye until recently, the last few
Right.
years. So you can't be outraged that, oh my God, he didn't tell me about that because it wasn't a thing then,
Right.
you know?
Yeah.
Like in this one video that we watched, it was Philip DeFranco video, and he had interviewed this one woman. She was the creator of this one Facebook page that has like 70,000 members, and one, I don't really think that's the credible source in general, but they talked to her about the breast implant illness that she said that she had experienced, and she was not, even just being a founder of a Facebook group, I don't think that she was a credible resource because she was kind of making up stories about silicone and the company
Yeah.
Dow. She was saying that Dow had invented silicone as a pesticide and that they had created Agent Orange,
Yeah.
and that I was like, not what?
Yeah.
Like, none of that's true.
It almost even sounds like it just has that feel of conspiracy
Conspiracy,
theory.
yes. Like,
Yeah.
that's what I'm like, are you thinking that the government is implanting these silicone objects into people and that's how they're trying to like suck the life out of you? Or she didn't, I don't know, she seemed like a tinfoil hat kind of
listen,
lady.
I mean, like, listen, there is some like truth is stranger than fiction type of stuff out there.
Oh, of course.
But I don't think that's one of them. And not
No.
only that, but you can't sit there and boldly claim that this company was responsible for making a very specific product that's going to be very easily like you could fact check that very easily.
Quick Google search and they'll be like,
No.
And I feel like I was a little disappointed in Philip DeFranco for like, you put that in you allowed that to be recorded, you put it out on the internet, and like when you look through the comments, people are like, I don't really love your shit, but what the hell is with this lady? Like, why are you using her as a credible source? Unless you're doing it satirically.
Right. Yeah.
And if that's the case, like, you're not doing this conversation any justice.
No.
And that I thought was like a little weird because normally he's very good with that kind of stuff.
Right.
But even that guy that they had on, oh God, what was his name? Sasha something. I don't know who he was. I think they had used him as a...
He was an investigative journalist though, right?
Yeah, I think that was it. And the one thing he was talking about, like after he said it, I was like, that was like literally one of the dumbest things I think I've ever... Well, okay, it wasn't dumb. It wasn't nearly as dumb as what she was saying earlier. But he had said that, people will get like shunts or like pacemakers that have silicone parts in them.
Mm-hmm.
And they don't, like, there hasn't been any issues with that, or like if there were any issues, like it was related to the amount of silicone, blah blah blah. But I think what he was saying was that you couldn't tell whether something as small as a shunt or a pacemaker could be, if that were causing problems. Then what about the breast implant? That's like a much larger thing. Like,
Right.
They didn't know about how much silicone in the body could be deemed as dangerous
Right.
or harmful. And it's like, well, then your statement just like, you just literally said nothing.
Yeah.
Nothing of value did you just add, because you don't even know if something like a shunt or a pacemaker could be dangerous. So why are you just automatically assuming that because it's bigger that it's harmful?
Right. Yeah, I think that's, again, kind of leaning towards the argument of you just don't know because there isn't enough research. And I know, like, we were watching too, there were some concerning things about the FDA kind of downplaying some of the complaints and some of the concerns that they've had, which unfortunately they've been known to do.
Yeah.
Which is concerning. So I think, I don't know, I think from what I've gathered, from watching a couple of those videos, talking to you about it, I feel like there probably is enough concern to maybe do actual research on it and actually start looking into it. However, but I think in general, I think there's a community full of women who are just frustrated. They're frustrated, and your anger is taken out on probably the wrong things. But I understand the frustration of not really having a clear-cut answer.
And I think that happens a lot with women when it comes to medical issues in general. There are a lot of women that they kind of get shooed away by medical professionals because they think that they're being hysterical, think that they're making stuff up, when they do have legitimate medical concerns. Like, I know you had to go see several doctors in
For
order to believe,
everything.
like, yeah, for all the issues that you've had. And that was the case for one of the women. She had made a YouTube video about her BII journey, I
Yeah.
guess, like from when she was first diagnosed. Not diagnosed. She wasn't diagnosed. That's the thing.
The first time that she was self-diagnosed.
Yes. So from when she self-identified that she had BII and like all the issues that she had, and then pretty much when she took them out, essentially that she was fine, which I think can lead to that's a placebo as well.
Yeah. Well, yeah, there's a placebo effect, and I would like to see a percentage of those women, like maybe 2-3 years after them being taken out, and see how they're feeling still.
Yeah.
I mean, especially if it's something autoimmune, it can flare up. It can come and go.
Mm-hmm.
You know, I mean, I think like I can sympathize with that kind of frustration, but I think the difference between me is that like I just needed to find a doctor who knew what the fuck they were talking about.
Yeah.
Like all of my issues were very obviously diagnosed. I was able to get surgery to correct them or medication to correct it, whatever. Even as simple as like when you're like listing off all of the symptoms of like chronic fatigue, brain fog, joint pain, I was like, that's just vitamin D deficiency.
Yeah.
Like I wasn't sure what it was, and I finally was just like, you know what, my insurance will kind of cover it. I don't need a referral. Like I'm skipping over the 500 tests that my family doctor's going to put me through, and I just went to go see rheumatologist.
Yeah.
She was nice enough to listen to everything, and she's like, well, you definitely have an ANA, like reactive positive body, whatever the fuck it was.
I think it's a negative ANA. That means you have an autoimmune.
It was ANA was present. And then they'll do like the ANA.
It's anti-nuclear antibodies, isn't it?
Yeah. So like the initial one was positive, and then you'll do like the nuclear study.
Oh, okay.
Like,
to see which. Okay.
Right. So she was like, it's definitely there, but she was like, your rest of your test kind of came out like.
Well, the thing
normal.
is, like ANA, that's Raynaud's.
Right. Well, that's what she was saying. She was like,
Yeah.
so most likely that's what's like causing it, but you also have vitamin D deficiency.
Yeah.
So she was like, take this, come back in a few months. She's like, you might have fibro, like with some of like the skin sensitivity you're telling me, but she's like, take this first, let me know how it goes. And I can tell you, like, it's most likely just vitamin D deficiency.
Yeah.
Like I felt significantly better, and it's something that simple, but I didn't sit there.
We're having fuzzy camera issues. Where were we?
Just going over the frustration of having to ask several doctors and not getting an answer or being told that you're fine. Like,
yes. Okay.
Yeah.
So that part of some of these women's stories, I do believe that, you know, they, at least with that one woman anyway, she said that no one, like, she couldn't get a diagnosis from anyone.
Yeah.
Or she had, and so she was just like, okay, I'm just going to take them out. And then that seemed to magically help her.
I just, like I said, though, I think the frustration with this in particular, though, is that there is no official testing and there is no official diagnosis to push. I mean, essentially, like, listen, there's a group of women who truly adamantly believe that this is an issue.
Well, yeah, but like, okay.
But I'm saying that's the frustration of it, is that from their perspective is that they feel like they're not being heard, and they're experiencing all these things. And medical communities like, it's bad for business. So,
well, yeah, but also, like you said, because the list of symptoms is so long and varied, you can't really you'd have to test for literally everything under the sun, and because there are some tests that are like, they could be inconclusive no matter what.
Yeah.
Really the only test, I think you brought this up earlier,
it's just to take them out.
was just to take them out. And then that's again a couple $1,000 surgery,
right,
to take them out, and insurance isn't going to cover that.
Insurance isn't going to cover it, but you got to think, like, I guess from that perspective is at what point, like, you're not going to leave them in anyway. So, like, hypothetically, like, I understand that the difference is like if you had a diagnosis and it was covered under the insurance, then that's where it makes a difference.
Yeah.
Like you're putting light and you're actually giving like proof that this is real. There's something wrong with the situation. So, they're going to pay to take it out. But like theoretically though, if the insurance company hasn't gotten caught up to there, or if you still had a super high deductible and you were given this diagnosis, you're still going to do it.
Mm-hmm.
Like if you truly feel like this is what is wrong, you just like you sunk the money into getting them done because you felt like it was the right thing for you at that time.
Yeah.
Is it right that you have to pay for it when it's potentially, in a very loose term, possibly medical negligence? I get it,
Yeah.
but at the same time though, like if you're being told like this is, it's like, all right. So for an example, my mom was recently diagnosed with a cyst on her spine.
Mm-hmm.
So they're like, your options are, she was having really bad hip pain. She's like, it keeps me up at night. She's like, I'm not sleeping. My mom owns her own business. She doesn't have the luxury of just fucking calling off of work. So
Yeah.
she got suck it up. So, but her options were, you can either try a cortisone shot and we can try to get the inflammation down, and that should help alleviate some of your symptoms. And regardless of where you get a cortisone shot at, might work, might not work, might work for a couple weeks, might work for a couple months. They don't know. It's a crapshoot. They're like, or you could do that, or you could get it removed from your spine.
Mm-hmm.
That's going to be really risky.
Yeah, any kind of spine surgery or back surgery is risky. Also, any kind of cortisone shot is, no matter what the circumstance, is hit or miss.
Yeah. So, but even though she had something that was, you could see it, it was diagnosable, it was right there. This is what your issue is. And even with insurance, one shot was over $600.
Mm-hmm.
So, it's kind of, again, it's one of those situations, even if it was like an actual diagnosis, this is definitely, when we've done these tests, we've ruled this out, this is definitely what's causing like your symptoms, isn't a guarantee that you're still not going to pay out the ass to have those things removed.
Yeah.
So if you feel like at the end of the day, this is definitely what is wrong, you're going to do what you need to do to get them taken out.
Yeah. And especially with something like, in this case, like breast implants, like it is a cosmetic surgery. So it's not a necessary surgery. There are some women that get it after they get a double mastectomy. They might get breast implants.
Mhm.
And I think in that case, if you have the one girl at the studio was talking about, her friend had the marker that would indicate that she's going to get breast cancer.
Right.
It was like she's just going to, it's inevitable. She's
Right.
going to get it. So before it developed, she had the double mastectomy, and then she got the breast implants, and the insurance paid for it. All she had to pay out of pocket was $300.
That's not bad.
Yeah.
So my question with that then, so hypothetically, you go in for this elective surgery, like it's no breast cancer involvement, like it's purely cosmetic and elective, but your breast implant it ruptures, it breaks.
Mm-hmm.
Do you still have to pay out of pocket for it, or is the insurance going to cover that surgery? Because it's emergency, like you need to get it removed.
Yeah, I don't know. I assume that if it's in that case, they might do it.
I would think, but who knows? And I don't know. There's just so many factors when it comes to the insurance piece of it. I think
it, like with something like that though, it's the difference between, are you electively taking it out, or you have to take it out because it's an emergency,
right?
And it has to, like in that case, they're explicitly saying that it is an emergency. You can tell that it's ruptured,
right?
So it has to happen. But in the case of capsular contracture, which is they warn you about, at least I know they definitely warned me about it. Like everyone warned me about it before I even went for the consultation, and I asked the doctor about it, and he said that like the likeliness of getting it is normally like if you get it above the muscle, and if you go through like
The
if they
nipple.
cut if they go through the areola, because it's like naturally occurring bacteria that happens on the areola, that's kind of what causes capsular contracture.
So what does that mean?
The capsular contracture is a sac that forms around the implant, and it's like a hard sac, and it can make the breast hard and misshapen.
Right.
So, but it's caused by bacteria that's naturally occurring around the areola or in the breast tissue.
Okay.
So, in order to avoid that, doctors would recommend going under the muscle. But that's all part of the consultation, is to see, one, if you're a candidate for the surgery in general,
Yeah.
or for any surgery, that if you're a candidate for that particular surgery. And then if you are a candidate, what way do you want to, what kind of implant do you want, and how do you want to go about putting it in?
Right.
So because I wanted it where they cut in like right where the breast meets
Like your
the
fold.
the fold is, so that it naturally falls there. So the scar will heal and it won't be visible. It's not like if they did the keyhole scar around the areola, that might be a little bit more visible, but probably like if as long as you do correct aftercare, it would be fine.
Yeah.
But you can also go through the armpit.
Ugh.
But in order to go through the armpit, I think you have to get saline or something.
Well, that would make sense because they said with the saline ones they can fill it up.
Yeah, and
So I
that's
guess
what they
that would
normally
make
do with the
sense.
keyhole ones.
I don't know why anybody would elect to do that.
Yeah, there's a lot of options when you go to do that, but you have to think about what's right for you and like what your doctor thinks is right for you.
Yeah.
But because I have like a petite frame, they didn't think that it was right to do a certain size implant, and also going in through the armpit. They didn't think it would be good because of pull
Yeah.
and everything, and because that recovery is different, obviously,
Well,
than
sure.
going in through that, because when they go in through the fold, like they're cutting through chest
Right.
rather than armpit. So that's all different. But when we had talked about what I wanted, and there would be a less likely risk of capsular contracture with that.
Right.
So, but I had a warning about that, but I don't know with capsular contracture whether insurance would cover it if you wanted to get that removed, and whether that sac would still be present post,
right.
explant surgery. I don't know, because I didn't fully do research into that. I just once I figured out how you were able to contract it or how you were able to get it, then I was like, okay, as long as I try to avoid doing that, which was easy enough,
Yeah.
then it should be fine.
Right.
But it all depends on how you get the implant.
Right. Interesting.
But with saying all of this, though, I guess what we're trying to say, that with anything, whether it's cosmetic surgery, whether it's anything medical in general, try to do your research and not just going to a Facebook group and just taking everyone's word for it. Because
not only that, but, and I'm sure everyone's experience has been different. We obviously didn't have the time to look at everyone's. I have been to X amount of doctors and they test for all the same things. And a lot of people didn't disclose how many times they've gotten tests done. So for me, I've had to go for some of myself 2 or 3 different doctors, or go back to the same doctor and be demand further testing.
Mm-hmm.
So sometimes, I hate to say it, but sometimes there might be something else wrong. You go to one doctor, they do half-ass testing and they don't test enough.
Yeah.
And you just don't take their word for it all the time. And don't just, like you said, automatically fall back on, well, then clearly it's this.
Yeah. I just think I cannot think of an instance where I would go to a doctor, they give me a shrug, I don't know, or they say, no, you're fine, but you clearly know that you're not. I wouldn't accept no for an answer, because it's my health.
Yeah.
Why the fuck would I just wave it off oh, okay, well, I guess it's this then, and I just run with that. I would definitely try to get an answer no matter what.
Right.
There has to be an answer as to why you feel the way you feel.
Yeah. Well, it was I had to go to get a second opinion on my knee. And I was the first guy was well, there's nothing on your MRI, after waiting for 2 hours for the results. He's well, how have you been since the last appointment? I'm I'm getting constant muscle spasms and I can't walk for more than a half an hour without being in excruciating pain. He's well, there's nothing on the MRI, just go to physical therapy. And I stopped and was what is that supposed to do? How is that supposed to help? And his answer was, sometimes it just helps people. I sat in my car for half an hour and cried, and then I went and got a second opinion.
Yeah.
And they were just yeah, your kneecap, you have loose joints, your femur's crooked, and your kneecap's been bouncing around your femur like a pinball. He's there's nothing torn, thankfully. He was but there's a lot of there's some damage in there. We have to go in, we have to clean it out. You know, you have like some tissue and stuff that's pulling on those jagged edges, and you have some arthritis. Like, we'll just go and clean everything out, do some physical therapy, it'll be good. Cool. Had I taken that first guy's word for it,
You'd be
God only
with
knows.
even more fucked up.
Yeah, like I'm still always gonna have issues with it because my body's just crooked as hell, and apparently I just have loose joints. I don't know, but
Yeah. But that's the thing. Like I strongly encourage everyone to just give two shits about yourself and your health and try to get an answer for anything that ails you.
Yeah.
Like if it's to the point where it's like it feels like it's having a huge detriment on your well-being and it's affecting those around you, then don't stop until you get an answer.
Yeah.
But do your research. Don't just go to Facebook and look through there or do like a very weak Google search. Like try to go to actual medical professionals and, you know, find one that actually gives a crap about their patients.
Yeah.
Don't always go with the first opinion.
No,
I would
never
try to
go.
go
Never go with first opinion.
one, because even if they are giving you the answer that you want, it's always good to double check.
It's always good to double check. So, I would say at the end of the day, like, get 2 or 3 different opinions, especially if you're in that much chronic pain.
Mm-hmm.
And I mean, at the end of the day, if you still feel like the right option is to get your implants removed and you feel like this is definitely something that you have, fine. But I think what we're saying is like do your due diligence of continue to ask questions, continue to push doctors, continue to challenge them, ask other people, like, listen, some of these, like, a lot of the symptoms that they're expressing is a lot of autoimmune, and autoimmune can be really freaking tricky
Yeah.
to diagnose.
Or anything to do with the thyroid too.
Yeah.
The thyroid, like if you have, because I have hyperthyroidism, and that affects a lot of things.
Mm-hmm.
Because your thyroid affects just about damn near everything.
Yeah.
Literally everything. Like you can get hair loss because of that. Decreased appetite,
Fatigue,
increased heart rate, fatigue, insomnia,
weight loss, weight gain.
Yeah. So like there's all sorts of stuff that happens if it's a hormone level issue. So that's something that you have to get checked out too. And I get a lot of this way before the implant surgery, but like I had to get so many blood tests
Mm-hmm.
because of hyperthyroidism. So like just because you might have all these symptoms doesn't mean that that's necessarily it. Just cross all your T's, dot all your I's, like just do your research.
Yeah.
And I should note that like even though there were women that said they presented with symptoms of BII, there are also a lot of women that I know a lot personally that have the implants and don't have anything.
Right.
They're fine.
Right.
And they've had the implants for quite a while.
What,
years.
10, 15 years. One
Yeah.
of them, I think. Yeah.
And they haven't, like they're fine. So that's why I tend to think that it's kind of like a psychosomatic thing
Right.
with some of these women. But I think there are some women that legitimately had issues. So I guess to sum all this up, I think that it should be looked into to see if it is legitimate. Because there seem to be enough people coming forward saying that they have problems. And I think that on the other side of that, I think that there should be women that need to do a little bit more research, and they need to go to more than one doctor.
Yeah.
Or any doctor, because I don't know if there were some women that did. I think they just got the implants and they're like, I have all these symptoms.
Yep.
And then they just went immediately to explant, and they're like, oh, I'm fine.
Yeah.
There are some people who saying that like they got the implants out the next day.
Right. Well, it's just like
I don't
just
think
like
it's how
the
it
same
works.
thing with the anti-vaxxers. My kid was fine till I got this vaccination. Like literally 3 days later, they were completely different. No. Anywhoozle.
Yes. Anyway, so we try to upload episodes every Wednesday at 10 a.m. Eastern Standard Time.
Yes.
If we can't keep to that schedule, we'll let you know. If we go on hiatus, we'll let you know. But we try to do that every Wednesday. And then we also, throughout the week, on our social media pages, we try to upload things as well. So if you have any feedback for us, let us know in the comments down below. On YouTube, you can like and subscribe. On Facebook, you can like us on there. like us on Instagram and Twitter and all that kind of stuff. So if you look up Glitter Budget or No, I'm Just a Worm on any of those platforms, you will find us.
Yeah.
All right.
Okay.
So until next time, we love you. Bye-bye.